So first of all, welcome. Thank you so much for joining us. In case you would like to invite your cool friend to this cool webinar, the link is there. You can already see it, transalliance.miami/live. My name is Az, and I'll take you through sort of how this is going to work. First, I'm the Executive Director of TransAlliance, and I'd like to introduce two amazing people who have agreed to be on this webinar with me. First, Ashley Price from Transit Center. Ashley, say hello and tell us a bit about Transit Center and yourself.
Hi, yes, Transit Center is a New York City-based foundation that works to improve transit in cities in order to make them more just and environmentally sustainable. And I work primarily on our bus advocacy in New York City.
Thank you so much for being here, Ashley.
Thank you.
Dana.
Hey everyone, thanks for having me. My name is Dana. I work with a boutique transportation planning, urban design and architecture firm called StreetPlans here based in South Miami. And we do a variety of active transportation master planning. So primarily bicycle and pedestrian planning. And we also practice a methodology called tactical urbanism, also known as quick build, as well as a variety of placemaking projects. So we loop this methodology into both of our master planning projects. And then we're also interested in one-off projects, and we implement these types of things all the time. So we're really excited to kind of talk about this through that lens a little bit.
Thank you so much for being here. So I want to ask you all a bit about who are you? And you're going to see a poll pop up on your screen, and I'm going to give you guys a few seconds to vote. Get your votes in because we want to know who you are. I put an option saying I am a mystery. Please, if you only need to use that option because I'd like to know who you really are. But I know our audience tends to be a bit more fun loving. So if you feel like you are a mystery, you may choose that option. I included it for all of you. So I'm going to give you guys a few more seconds so we can get to know a bit about who you guys are. Keep going, keep voting. Do not vote twice. You can't. Right. Some of you are slow voters. Keep going, keep going. All right, I'm going to close that poll and I'm going to share the results with you. So most of you seem to work in transportation or mobility. Second, nonprofits. Third, governments. Wonderful to see advocates. And of course, 18% of you are a mystery, which I find pleasing. So how this is going to work, you can ask questions anytime during the entire webinar. This is not one of those webinars where we're going to talk for an hour and then we're never going to hear from you. Maria, can you introduce yourself?
Hi, everyone. It's good to have you all with us today. My name is Maria Cristina, and I'm the campaign organizer with Transit Alliance. And today I'll be moderating the Q&A, so I'm looking forward to it.
So in Zoom, you will see a box called Q&A. At any time, you can press that button and you can ask a question, and Maria will be going through and looking at your questions and helping figure out which ones we answer. If you are on YouTube, Marcia will be there moderating your questions. And if you are on Twitter, Derek will be live tweeting this. I can imagine that if you put in a Q&A and if you actually say, Maria Cristina, how about this question? You probably might get some more attention. And this is the flow of what we're going to do. So I'm going to talk a bit about what's happening in Miami. We're going to do some quick questions after that. Ashley will talk about what's happening with transit nationwide. We'll do some questions after that. What's happening with streets nationally? Dana will cover that. Quick questions. Then we'll have a discussion with all of you, talk about what's next, and then say some goodbyes. So I'm going to dive right into it in terms of what's happening in Miami. So if you don't know us, we're Transit Alliance. We're a nonprofit organization advocating for walkable streets, bikeable neighborhoods, better public transit. And we do this in three ways. You'll find us out in the streets, not right now, but usually talking to people on the ground about what their experiences are. You'll find us in the halls of government advocating for better policy. You'll find us doing a lot of research into what's going right and wrong with our systems. If you're not familiar with our work, some of our campaigns, we have measured the performance of the Metro Rail in real time. We're redesigning the entire bus system, the Better Bus Project. And we've launched a campaign for coronavirus and mobility, which is the topic of today's conversation. So what is happening in Miami? And remember, as I go through this, you can ask questions anytime. We'll do some quick questions afterwards. First of all, before we get there, if you do work in government, if you're an operator, if you work in transit, thank you, because I know that all of you guys are going through some enormous stress to keep us safe and to keep us healthy. A lot of you are on the front lines of facing this crisis. We've had operators in other cities lose their lives. It's a frontline job, and we thank you so much for keeping our city moving and for keeping us protected. So thank you. Ridership is down 80%, as Jesse reported in the Miami today. And that's not a surprise, obviously, with not many people moving around. But in Miami, the change in demand is less of a drop than other places. So we have a higher relative demand compared to a lot of cities that have seen that sort of ridership decline. So you have buses that are both empty and full. So of course, there's a lot of routes that a lot of people aren't using right now, but you still have buses that are seeing so many people that people are crowding right now. And from the Miami New Times, Alexi said, if during normal times a picture is worth 1,000 words, during a pandemic, some pictures are worth 1,000 face palms. This overcrowding on one bus route probably being one of them. And why are these bus routes full? It's because in Miami, 36% of essential workers depend on transit for their commute on a regular day. So if you have the privilege of working at home and not having to go outside, a lot of our essential workers are on transit right now trying to get to work to make sure that our society keeps running. Protecting transit workers. Doug Hanks from the Miami Herald did a great article on the transit union considering suing Miami-Dade County for more masks and hand sanitizers, because transit workers here and across the country haven't been afforded the same protections that a lot of frontline workers have, even though their exposure to the virus right now is extremely high, given that you're stuck in a bus, there's nowhere you can go. However, the department has taken some quick actions and has done them quite well, suspending fares, introducing rear door boarding, requiring masks for riders. But a lot of these things have come pretty spontaneously and without much communication, sometimes with just overnight notice. We are one of the few cities to have banned shared bikes and scooters, along with Atlanta. Most cities are deploying these services for essential workers to make their lives a little easier. Unfortunately, we have banned them, which we can get into if you ask a question. And coronavirus testing. It's really difficult to get tested for coronavirus if you don't have a car. So if you are a homebound, if you are a senior or someone with a disability, you can get home testing, but if you don't fall in within those categories, you need a car to get tested. We have some amazingly safe, magical streets right now. If you have been outside for a bike ride or a walk or a run, you've probably seen how much safer you feel just walking around compared to a regular day, which is just a strange consequence of what we're going through. And we also at the same time have crowded sidewalks, but empty roads. So Linda Robertson just put out a great article this morning on questioning why we aren't closing streets for people during this time. Moving to the state level, Florida has been expediting some road projects, which depending on how you feel about expanding roads, as opposed to prioritizing transit, you might take some issue with. And good news on the national level is that Congress has passed a relief package for transit agencies. So Miami-Dade County stands to receive around $430 million in transit relief funding. So if you're thinking the transit system is collapsing and oh my God, it will never come back, there's some hope that it might come back. So I want to stop there. Those are the 10 things for coronavirus and mobility that you should know. And I'll take some quick questions if we have any.
Great. Yeah, we have a couple of questions coming in right now. So the first one is from Sean, and the question is regarding, how do we prevent our county budgets from shrinking, considering, how much the transit budget is suffering right now?
So I think I'll divide that question in two. I think the federal government needs to think more about like local and county assistance, because our municipal and our local governments, depending on the sort of revenue streams that they do, are going to take a big hit. Transit, unfortunately, is funded from the general fund, which will also take a hit. And in other cities, it's sort of unavoidable. Even in cities that transit has its own dedicated source of funding, they have been taking hits as well. But I think it's a moment to think about right now. Transit is such an essential service, right? Transit's always been an essential service. Somehow now we've finally realized that when all of these essential workers need to get around in the course of a pandemic, that it's essential, but really it's always been essential. We need to think about the sort of dedicated funding for transit that could keep it going now, but also into the future, and not just think about the current funding strategies that we have, that we're stuck with. Anything else, Maria?
We do. So we have another question that is regarding bike sharing. Are we seeing that bike sharing is increasing during COVID-19? And relatedly, how do we see our general transit culture changing throughout this time?
So bike sharing is not increasing here because it's banned. But I think you meant in other cities, right? In other cities, it is. I think New York is the best example. And Ashley, if you remember the specific number, correct me, but I think it's up like 40% or something like that. And I think you can also feel it outside. If you look onto the street, which my window does, you can just sort of feel how many cyclists are out there. And I think Dana will give us some more context if she feels like. How much time do we have, Maria? Should we move on to Ashley?
We have a couple of minutes, actually.
Okay,
So we're a little bit ahead of schedule.
Wow, great. You tell me. Another question?
Yeah, so
maybe?
Last question. This is from Carmen. How do we calm fears about public transit as cities start to reopen all operations?
Oh, it's a difficult question because I feel you on a personal level and I also feel you on an advocate level, where on a personal level, whatever I feel is whatever I feel. But on an advocate level, we don't really, the thing I want just to think about is for a lot of people, they don't have the choice about feeling and fear. Do you know what I mean? Like they're going to be on public transit regardless of how they feel and whether they fear, because they need to get to work and it's the only way they can get there. So I think the way that I would reframe that is how do we make sure that moving forward out of this crisis, that riders are protected, that operators are protected, that as we start to recover, that we think about this proactively and we don't just let these issues fall by the wayside. Because I don't think it's going to happen with just a mental change in our minds that we're all going to sort of decide, oh, public transit must be fine right now because I'm doing all of my other activities. I think we probably need to take some active steps. And even in the midst of the crisis, right, you'll see a lot of transit agencies that even now have hand sanitizing wipes deployed on every vehicle. You have transit agencies around the world. I think Istanbul is a good example where they have a subway, so it's a little different, but you can get masks on demand for free repeatedly. So there's the near term, there's a long term, but again, for a lot of people, they don't have a choice. So we have to make sure that we fight for them.
Great, and I think we can move on to Ashley now.
Cool. So yeah, thanks Az for that helpful background and context on what's going down in Miami. I'm going to really just go through a brief overview of some of the things that we're seeing pop up for agencies nationally and also touch briefly on how advocates are responding. And just before we get started, another sort of quick touch on Transit Center. Again, we're a New York City-based foundation and we work nationally on improving transit to make cities more just and environmentally sustainable. You can find out more about us at transitcenter.org. And so again, sort of the three issues, I'm going to touch on three issues that I think agencies are facing now or really coming to the surface for agencies during this time. And the first one is really the need for agencies to reallocate service, not just in terms of public health, but also as a means of promoting equity. And for some context there, you know, as kind of set the stage for this, there are 2.8 million Americans who are working in essential roles who still rely on transit for their commutes. So despite some of those sort of huge declines in ridership that agencies are seeing, a lot of riders are traveling on these routes that are seeing major crowding and, you know, putting themselves and operators at risk without adequate distancing. But another key thing to note here is that sort of this remaining transit workforce isn't just kind of like a smaller version of the overall transit riding workforce. They have really different cumulative travel patterns. So things like traveling outside of traditional peak hours and having very specific destinations. And we're also talking about a group that is disproportionately people of color and, you know, more likely to be at severe risk of illness or death from exposure to COVID-19. So, you know, a lot of agencies facing a lot of the funding constraints that they are right now are going to, you know, reduce to service schedules that look like holiday or weekend service across the board. But I think while recognizing those constraints, any service readjustments and service planning during this time really needs to be tailored to what we're seeing on the ground and the needs of the riders that are still taking transit during this time. Otherwise, all of this crowding will continue. So one sort of highlight example I want to talk about here is SF Muni in San Francisco. They developed this sort of COVID-19 core service plan that focused on 17 routes, a major sort of decline in the number of routes they serve. I think normally it's north of 80. But, you know, facing constraints, they realized that they needed to prioritize service and they made the decision to focus on these 17 routes based on the agency's existing equity strategy, some of the travel patterns that they saw emerge after the shelter-in-place order first went into effect in San Francisco, and based on prioritizing connections to medical facilities. That's sort of one way that agencies are looking at really considering what the conditions on the ground are before they make service changes. Sort of the second issue that we're seeing really rise to the surface for agencies is the need to protect extreme risk of exposure, but a lot of agencies are struggling to get them PPE, protective equipment. And I think Port Authority of Allegheny County is, no different. They're also struggling with sort of sourcing PPE for their operators. But what's really stand out about them is the way that they've worked with unions, worked with transit unions and transit operators to come up with an additional set of tools to protect their operators. So, they've done things that we've seen nationally from other agencies like route or boarding, suspended fare collection, and limiting the number of people on buses. But they've really done a lot on depot protections, things like experimenting with letting their operators check in for their shifts via FaceTime to limit contact, installing sneeze guards at the windows where operators receive their assignments. But they've also been working on things like allowing operators to use administrative leave versus burning through their sick time for COVID-related illnesses, and experimenting with giving operators staggered shifts. So that's sort of one example of that. And then the third thing that we're seeing really rise to the surface for agencies is how to communicate about this crisis. Obviously it's brought up a lot of challenging issues for agencies, revenue shortfalls, lack of PPE, huge ridership declines. I think the instinct for a lot of agencies is to sort of clam up about the challenges that they're facing, but SF BART really sort of made the decision early on to be honest and open with their riding public about the challenges they were facing, and the extent of the hole the agency was in. And I think in addition to appreciating that kind of honest communication, it also sets the stage for riders for any sort of service changes or adjustments that will inevitably have to come down the line. The other big thing with SF BART is that they really took this accommodating stance or made an effort to be really accommodating of the essential workers that are still riding transit. I think we're seeing some agencies have messaging that's kind of like, don't ride, stay home, and nothing else. But I think SF BART has been really keen on acknowledging sort of, the difficulty and the nuance in being an essential worker and having to get on the train during this time. So those are sort of the three major buckets for transit agencies: comms, operator protections, and reallocating service. Then shifting quickly into what we're seeing from advocates. One of the first things is just really communicating the essential nature of transit, as mentioned. And we've been seeing that on social media, but also through a lot of national coordination among advocates in ways that we haven't seen before. And I think a lot of that national coordination was really a linchpin of getting that $25 billion of funding for transit agencies in the last stimulus package. So that communicating the essential nature of transit, but also really working in close contact with operators and transit unions to really elevate their needs. So we're seeing an example here from Active Trans in Chicago, but lots of advocacy groups across the country are doing this, really standing with unions to call for PPE, for better protections and better federal guidelines for operating during this time. And then one of the final things is just elevating the needs of riders. So here we have an example from Riders Alliance in New York City, a survey they put out to their membership that's still riding transit at this time, really trying to collect those stories and see what these riders are seeing on the ground in order to, elevate those stories with decision makers and with the public in general to ensure that transit is protected. So that was really rapid fire, but I will stop there and allow for some questions.
Thank you so much, Ashley. We have a couple of questions regarding Miami specific, COVID-19 transit response. We have a question from Doug that's asking, what does Miami-Dade need to do to have transit be safe during coronavirus? And if you've heard of, other cities, have specific benchmarks on PPE, on capacity, and, what can be done here to sort of, mitigate all the negative things that we've seen happen.
Yeah, I mean, I think the one thing is really just a deeper analysis of ridership that is happening right now, what the conditions are on the ground, where are people taking transit now, where are riders seeing crowding, and that is just, involves speaking to riders, reaching out to advocacy groups that have in terms of guidelines and benchmarks for PPE, it's like being in conversation with your operators, with your transit worker unions. I think that we've seen some guidelines from CDC on this, But one of the complaints from some operators and from some transit workforces that really don't go far enough to protect operators and to protect this frontline staff. So really having these conversations with riders and with operators to find out what they need and trying to elevate those things with decision makers.
Thank you so much. And we have another question that's a little bit more broad, but how can we, like, almost like utilize this opportunity, this crisis as an opportunity to, improve transit in general? And I think I'll just put this out to all of the panelists, not just Ashley.
Yeah, I would say, again, we're seeing, a crisis like this really kind of only exacerbate some of the underlying inequities in our systems. And so I think having strong plans for addressing the crisis now can only set agencies up for better service in the future. So, things that we saw from like SF Muni about having an equity strategy in place in advance of this really helped ease some of the tension and the burden of decision making about how to reallocate their constrained resources. So yeah, really agencies taking this time to become proactive in how they plan and how they redistribute service and having a framework for doing that.
Dana, do you want to go?
Yeah, I mean, I was also going to say something that transit agencies could potentially take away from this too is the value that people place on transparency. So right now, some of the examples that Ashley mentioned, they're being very open about how this crisis is affecting their ridership, but also thanking their riders. And there seems to be a little bit more kind of that communication happening, which I think could be very valuable just to maintain, because there are always things that, might come up with transit riders and different adjustments that are made in transit systems and stuff. So for agencies to get used to that kind of communication and not be afraid of it, I think is also something to take away from this.
I yield my time in case there's some other questions, because I see quite a few. But you tell us, Maria, where are we going from here?
Yeah, no, I mean, we have about a minute to, for the specific portion. But I think just in general, what else are we doing to sort of, expand, not just expand transit, but really like improve like our current infrastructure, like surrounding transit. So we've seen that in other cities, for example, they've used this time to create like rapid bus lanes and other improvements. So, what else can be done locally to really, get our transit really up to speed?
Actually, I don't know if you want to, some of your favorite examples from around the country and things that Miami should be doing, which I'll talk about, but I think we need to learn from you guys a little bit.
Well, honestly, I think, it's a challenge because, transit agencies and city DOTs are really facing financial constraints at this time. And so it is a great time to like get all of those kind of projects, that dream projects, bus lanes out the door. But, agencies are really grappling with funding shortfalls. But yeah, my own personal opinion is like, get all of the bus lane projects done now.
Or a redesign, which we'll talk about.
Yeah,
at the end. Maria, are we ready to switch to Dana?
Yes, we're ready to switch.
All right. Okay, so again, thanks for having me. So sort of similar to what Ashley did, I'm going to run through some of what we're observing in terms of cities, making changes to their streets to accommodate primarily safe passage for essential workers and essential trips, and as well as to facilitate social distancing as much as possible in our roadways and on our sidewalks. So we actually have an open Google spreadsheet going. Let me know if you want me to share that with you. We've kind of been tracking all of the different tactics that cities are using, mostly infrastructural, but we've also obviously been tuned into some operational strategies as well. And so I've simplified some of these, and I'm going to go through them also relatively quickly. So infrastructural, obviously we have things like different street closures. I know that's a topic that we've kind of all been aware of, pop-up infrastructure, as well as some other operational strategies. So to start off with full street closures, we've so far documented 16 US cities, but a lot more cities internationally. So the list internationally is probably over like 60. And so primarily these 16 US cities are closing things like parkways, park drives. So these are streets within large parks, as well as waterfront boulevards or streets that are adjacent to waterfronts. And so this is, you know, this is happening in cities that are closing parks and that are also not closing parks. So it's not just something that cities who have closed their public spaces are using. It's also all cities are finding utility in doing this. And it's primarily to create, you know, that release valve for people who are spending times in parks, but maybe the park pathways are too crowded, as well as accessing parks. And then also, again, we can't forget, you know, essential workers potentially sometimes use parks and park drives as cut-throughs to get to work. And it's a part of the off-street infrastructure that they could be using as well. We're also observing, especially in Denver, for example, the cities are closing the parking lots within parks as well. And this is to try to limit, if the public spaces are open, this is to limit access to those parks to really the most local of residents. This is so, you know, so as to not encourage people to drive into these parks and just kind of increase the amount of people in them. We're also observing street closures, obviously on residential and commercial streets, not so much as parkways and park drives, but it is slowly starting to happen. New York City, Denver, and a city in California called Emeryville are doing this. And we're also, of course, observing guerrilla responses, people, you know, closing their own residential streets and that sort of thing. But just to keep in mind, you know, a note about these closures are not programmed open streets events. They're not intended to bring more people out into the streets. This is to facilitate and make easier essential movement and movement along these roadways that's already happening. And then just a note here, you know, for example, Bogota, Colombia has a very robust open streets network. They have about 75 miles of open streets. And they, during this time, were able to use that network kind of as a blueprint to start with, to see where they could roll out some street closures right now. And they use that kind of as a roadmap, and they've been tweaking it and you know, making changes along the way. But it's just a note, something to think about, that cities potentially with existing programs and pathways to closing these streets and using them flexibly have been able to respond a little bit more quickly and efficiently during this time of crisis. And then we have partial street closures. So we're mostly seeing this to extend sidewalks by closing the curbside parking lane or curbside travel lanes. And this is not pretty. We're just using, you know, cities are just using traffic control equipment that they have on hand. I'll also note, you know, these two examples that I have featured here, these are on commercial streets. It's also useful on, you know, streets where sidewalks might have a lot of obstructions. So, you know, I know some streets in our downtown area have a lot of planter beds and planters and awnings and street furniture and that sort of thing. So they're being utilized there. Streets are also designating delivery and pickup areas just to make sure that people, you know, continue to keep moving and aren't really loitering or hanging out on the streets. And then shared streets. So cities are limiting traffic on streets just to local traffic only, primarily to kind of lower the traffic volumes and also the traffic speeds and make sure that other users are remaining safe. And these are just a couple of local examples. I live in Brickell. Obviously, I'm not really going anywhere else right now, but I just thought I would pop out and see what was going on. This top left picture there, it's kind of hard to see, but there are just a lot of people out in the street. And that parking lane off in the distance still has cars parked in it. And meanwhile, there are probably like 5 to 10 other people in the distance there trying to use the sidewalk. And so that was kind of something that stood out to me, as well as people, you know, waiting to enter stores in parking lanes and buffer areas. On South Miami Avenue, people are already just rollerblading in the parking lanes, using the streets. And then obviously on Ocean Drive there, you see pretty much an undoubtedly high demand for potential full street closure there. And just a note, you know, some people, obviously you're seeing that people are already using parking lanes or already using the travel lanes, but if anything, that's more incentive to protect them by fully closing and by putting the traffic control equipment out there if possible, because as traffic volumes are lower on these streets, we are actually seeing increased speeding as well. Temporary bike infrastructure, we're seeing less of this, but New York City is trying out 2 segments. And what's interesting about this, and I think particularly relevant to Miami-Dade, is that these segments are in their master plans. This is infrastructure that they were going to implement imminently, and they're using this time to accelerate that. And so I think it's an interesting point. You know, they have a master plan. The work of identifying potential bike lane segments has already been done. in terms of identifying, first, last mile routes to transit, which are especially relevant now for essential workers, and also other corridors that are going to denser areas that have essential services. And so that's definitely something to take note of here, as I know that we also have, obviously a lot of bike lane projects in the works, and we can talk more about that. And then finally, operational strategies. Cities are using signal adjustments, to shorten traffic signal cycles to make sure that cars don't just have green lights for miles. Actuated to fixed pedestrian signals. So this is, turning the pedestrian signals on automatically on a green light to make sure that people don't have to touch the beg buttons to cross the street. As mentioned, cities are actually either discounting or making free shared and micromobility, like bike share and scooter share. And bike shops have remained open as essential businesses in other cities, and are really doing a lot to provide bike donations to essential workers as well. And then finally, cities are reducing the speed limit temporarily on some streets that have excessive speeding now because of lower volumes. So just some considerations. I don't want to have this conversation in a vacuum. Some things just to note here. Obviously, we cannot only talk about dense areas like Brickell and downtown and Miami Beach that might be more affluent. We need to consider other areas of density where these strategies could be useful, like public housing and other neighborhood cores outside of the most dense areas of Miami-Dade. We also need to be sensitive to, not over-policing streets if these tactics are to be used. New York City got a lot of pushback. They did actually attempt to close some streets for about a week. They got a lot of pushback about this, just because it kind of exacerbates some already uncomfortable situations with people experiencing, things like racial profiling, et cetera, in streets. And then the other side of this conversation, there are multiple sides, but the unsheltered population, streets are also people's homes in Miami-Dade. And these people are also especially vulnerable. And so that's just something to consider as well. So very last slide, I'm probably over. Just to emphasize, this time, we're obviously under very tragic circumstances, but it could also be a moment to test a framework for delivering stuff like this in the future. Things like, where would we get the traffic control equipment from? How quickly could we do this? What is the messaging? What are primary corridors? And it's not just right now, it's to help, keep people safe and healthy, but how can we come out of this more sustainable and implement some of this stuff long-term in Miami-Dade? Less traffic now would make some of this stuff easier to implement, just saying. Personal opinion, we know that other roadway projects are moving forward, but these should, be as important, if not take precedent over things like highway expansion and other things. And then just finally, what could we do with Transit Alliance to make sure that these decisions are informed? None of these cities are doing this haphazardly. How can we collect feedback from people who are out there experiencing this and consider getting some of this stuff on the ground? And that's it. Thank you.
Thank you so much, Dana. So we have a question from our YouTube stream, and this question comes from Richard, and they're asking if there's any existing data on the change in traffic fatalities and injuries because of COVID-19.
Yeah, that's a great question. I have not seen any, and my guess would be that it's just a little bit too early. Like, cities are probably still kind of grappling with how to do this stuff most efficiently. But I will say that we've been keeping up with a couple of cities specifically, and they have not reported any, issues or any anecdotal feedback, at least, of people, feeling less safe going out on roads that are closed. It would be very valuable to have that information, but I think most cities are just focusing on, how to act fast. And maybe that's something that we can encourage some cities to do, or maybe even do here, so that we can be informed as, this pandemic continues. That's a good question.
Great. And we have another question from Marissa, and she's asking, how can we harness all of the people that are newly riding bikes and or scooters during this time so that we can continue to keep them riding post COVID-19? And in general, how do we contribute to this improved feeling of safety in Miami, that people have been experiencing during the COVID crisis?
Yeah. I mean, that's kind of what my last point was about. I think we have the opportunity working with Transit Alliance to really keep that conversation going. And also just ask constituents. I don't know all the details of your guys' campaign, but I would assume, part of it is asking people to submit examples, asking people to submit their own experiences, any other observations they have, so that we can keep a tally on kind of how things are working now and what parts of it we can keep alive, after this all subsides, and what would be the best way to do that. So I really hope that we can, kind of continue to work together on it, whether it's through social media or the campaign or something. I think we have a really good opportunity to keep tabs on it and keep everyone involved.
Great. And I think we have time for one last question. And this is coming from Fabian. And they're asking, when choosing to lower posted speed with temporary signage, is it a good idea to pair such action with other temporary measures that would help us lower speeds and help create friction?
Yeah, that is a great point. I would agree. So, a lot of the times, strategies to lower speeds don't necessarily have to be through enforcement. They can be by design. So for example, separated/protected bikeways, for example, do that. On-street parking does that. And so, yeah, I agree. It's maybe on, something like South Bayshore, South Miami, putting some traffic control equipment up there. We, at least in our experience of doing tactical urbanism, anytime you make something look like a construction zone, typically we observe people slow down, just kind of be a little bit more aware. And when you couple that also with enforcement, I think that would be kind of a good 1-2 solution.
Cool. So we're about to go into the discussion phase. And I just want to give a shout out to some people I was looking in the participants box that I'm so glad that you're here. You know who you are: Julian, Victor, Servando, Sean, Paul, the other Maria, Sydney. So good to see so many of you here. And so amazing that 98 of you stuck around throughout this entire thing. This webinar is capped at 100 people, so at 2 more people, we're full. So what we're going to do now is, I just sent a message in the chat box. The chat box is now completely open, free for all, which means that you can type, everyone will see what you see, we will see what you see. It's a complete free for all. So you don't have to worry about submitting a question and having Maria pick your question. You can just type straight into the chat box. And again, if you haven't found it, I'm typing another chat message. You should get a little message that goes bing. So for the next 10 minutes or so, it's a completely free-flow conversation. Please type in whatever you're feeling and thinking, whatever questions you want us to answer, wherever you want us to take the conversation. We really want to hear from you, and Maria will help steer this conversation in a direction. So Maria, take us somewhere.
Sorry, I was on mute. So we have a question from Roger, and he's asking, looking into our crystal balls, what will mobility in South Florida and NYC look like after all of this is over?
I'll let you start on that.
I think it's kind of directly correlated to how different life will be, right? If anyone is like me, or sort of thinking about, and I was having this conversation with Tim on our board yesterday, about, you think about restaurants and you think about cinemas and you think about community spaces and all these wonderful things, and when will those get back to normal? And we'll talk about a time when, remember when you went to a bar and you could just walk up to people and shove yourself in there and grab a glass and not think about this? I think about mobility the same way that I think about that, and because they're both inextricable and related, right? So what does the future of mobility look like in South Florida in this? What I hope, and we think we need to be very conscious of, is recognize how the streets feel right now. Recognize that the future that we don't necessarily want to go back to, at least for us as Translines, is that we realize, oh my God, cars, very important. We must have cars. We must have more cars, and car dependency will forever be a thing. I think this is that sort of turning point where you start to see, as a country, certain systems unravel. And I think here in Miami, you sort of start to see also systems unravel, but you start to realize like how valuable street space is and how we don't need to go back to cars. Especially, again, if this is anything like 2008, a lot of people are going to come out of this crisis without cars. A lot of people are losing their livelihoods, cars included. So Maria, I'll throw it back to you in case more panelists, more questions, you tell us where to go.
Yeah, Ashley, I don't know if you want to just answer like on the NYC front.
Yeah, I'll touch on that briefly. I mean, I think from the hopeful perspective, sort of like Az was talking about, I hope this means that agencies will be more proactive about planning, developing equity frameworks, developing strategies and frameworks that they have in place at all times, because I think planning for a crisis is applicable, even planning for a redesign or planning for any other like future natural disaster, heaven forbid. So really just having a guiding set of principles for decision-making that really relieves some of the tension in service reallocation and things like that. And I think just like agencies will have to be really cognizant about ramping up their focus on safety and what that means and how they're communicating, how they're thinking about safety to riders. Yeah.
Yeah, and I think I'll add two things. So, kind of like Ashley was saying, what processes could we get in place now, not just to prepare for the next crisis, because obviously we hope that never comes, doesn't come very soon, but ways to use our streets flexibly. Like, how can we develop pathways for that now? What can we learn from this now so that we can utilize this in different types of settings? And then also, obviously now people are probably driving less. We're not going elsewhere. I know I, for one, am also appreciating walking even more than I was before, biking even more. And so obviously, the advocate side of us, we all kind of hope that people see the value in that a little bit more. But at the same time, we can't just expect that when this is all over, people are going to be like, I love biking and walking now. I'm not going to get back in my car, because our roads are still designed to facilitate the most efficient movement for cars. If we still don't have any infrastructure, better infrastructure for bikes and pedestrians after this, if there's nothing in the works, if we haven't figured out a pathway to kind of do some of this temporarily or in a quick build fashion, I am concerned that people are still obviously going to value getting in their car to get somewhere faster. I don't know how much will change. So yeah, that would be my take on it.
I like how we balanced each other out.
We've
Maria,
also been
tell us.
we've been getting a lot of questions about micromobility, and specifically the micromobility ban that was implemented a couple of weeks ago. And folks, are interested in learning more about, any updates on that, sort of any progress that we've made, and in general, why it had to happen in Miami specifically.
I guess I'll take that, and then you guys let me know if you want to jump in on that. Our city has a very strange, tenuous relationship with anything that's not a car, micromobility included. So as soon as this crisis sort of came out, there was a lot of quick reactions from government that we're all trying to figure out and explain to them, like, how are we going to prevent spread? Should we ban this? What is an essential business? Bike shops were closed here, for example. I think there was a moment when people were just trying to figure out, what do we do about this? I think best practices that have emerged around cities kind of show that the micromobility ban here might not make a lot of sense, since we're such a novel exception. Oh, that was a horrible pun. I'm sorry, it was unintentional. And on top of that, I think that everyone who's in Miami, and I know most of you are, that it's flat as a pancake, it's warm. Electric scooters work really well as a mode of getting around, as do bikes, as do electric bikes. I think it's more towards what Dana said, that you see this explosion right now because the streets feel safe. But if we don't come out of this crisis with streets being permanently safer, then that mixed relationship is sort of always going to continue. Because I think, when you go to another city, you can sort of feel the way a street is designed and feel the way that how they prioritize things just based on the environment. And when we return to normal in Miami, if that hasn't changed, then other things might not change as well.
Mm-hmm.
Dana, I don't know if you have anything to add on my little.
No,
rant.
I think that was good. Yeah.
Great. And then we've also been getting a lot of questions about the Better Bus project and how, the COVID crisis has affected our progress around the redesign. So, a lot of people are interested in learning, how are we going to move forward? And really more broadly, what should be our strategy when it comes to advocating for change around mobility?
Okay, Maria, if you want to answer this question with me, just jump in. Because, the Translines team, by the way, is all hanging around. They're all watching. So the Better Bus project is interesting because, and if you're more interested in specifically that, we're going to host some more virtual workshops, so come to that, because I can't get into as much detail here. But with transit ridership down so much, by around 80%, we as a community have a choice to return to a redesign that's almost done, that can be finished, and come back to a bus system that does better for essential workers, does better to give access to frequent transit to the vast majority of Miamians, does better for groups like seniors and African Americans, a bus system that we can return to for a recovery, as opposed to just returning to the system that we've had for the past 30 years with some iterations. It's an amazing opportunity for us to build that stronger recovery into our mobility policies. So what you'll find TransAlliance advocating for is that as part of the recovery, we should implement the Better Bus Project. There's some work to do. We need to finalize the plan. We need to do some more engagement. But this is the opportune moment to be implementing bus network redesign. Other cities don't have this opportunity. I mean, Ashley, I don't know if you want to talk about if you have any parallel examples you'd like to bring to the front of the conversation.
I mean, well, I'll just talk about New York City. We're sort of in the midst of our own network redesign process too, that is like pretty much on hold. And again, just surfacing a lot of the, fiscal and staffing issues that transit agencies are facing right now, which are very real. But I think, to Az's point, I think we are also very adamant about advocating for the kinds of changes in the network redesign to move forward. I think things like, prioritizing services to the communities that need it most, increasing frequency on routes that need it the most are things that hold true, during this time and outside of it. And a network redesign that is done right should really serve to benefit these sort of essential workers that are taking transit now, these people who were saying are heroes, they deserve to have better service once this crisis is over. So, yeah.
Maria, do you have anything to add just on the question itself?
No, I think I really just want to echo that, it is going to be more important than ever before to really make sure that our transit network can support a lot of people that may be, both existing and new riders, just given, the economic impacts that COVID-19 has had, all around the world, but specifically in Miami. We know that the people that have lost their jobs are a lot of those essential workers too, right? Because, when you think of restaurants, when you think of people who may work, as like janitorial staff and in other capacities, these are usually the same people that rely on a strong transit network. And we need to make sure that when we do come back from this, that people have, some access to their, to a public service, right? That, is going to be very, very crucial when we come out of this.
Mm-hmm. So I think we have time for maybe 2 more minutes of discussion before we wrap up. So Maria, take us somewhere interesting, maybe somewhere we haven't been before, based on what you're seeing.
There's a question about how transit agencies are handling free transit fares. So a lot of folks have been asking if this is a strategy that we think is going to continue for the next foreseeable future, and just in general, how we view free fares altogether.
Actually, it might be good for you to give us some national context, because you guys have put out some great research and thinking about free transit.
Yeah, I mean, I think again, I'll say a lot of agencies have sort of eliminated fare collection during this time, just to sort of stop the touch points. And it's an interesting conversation. I think free transit means a lot of relieved tensions in terms of policing and things like that for people riding transit, but also particularly given the funding shortfalls and revenue shortfalls that agencies are facing from decreased ridership, like fares are going to be super important in the future, right? An agency like MTA that gets like a lot of its operating support from funds from fares is going to be, really hampered if people are not paying for transit in the future. But I think that is the important part about having a fare collection system that is based on who can afford to pay for what. So having a tiered system, having a system that isn't based on harsh policing tactics, that's based on, really responding to riders and treating them humanely. But yeah, we'll still require people paying for transit, because I think, especially given where agencies are financially, it's going to be essential.
Yeah. I mean, here in Miami, free transit is a recurring topic because we have a lot of municipal trolley systems that are free to begin with. And a lot of people have been thinking about free transit, both on an elected level, but also on a community level. Why can't we just make transit free? Our fare box recovery, which means basically the amount we collect in fares relative to the amount it costs. We don't collect that much in fares compared to other cities. Why don't we just subsidize the whole thing and make it free? And just one parting thought on that. When you think about making transit free, which I'm not completely familiar with the number on the top of my head, but it's like something like 100 something million dollars per year. Think about, would you rather have a transit system that's free and spend that 100 and something million dollars, or would you rather have increased service for that 100 and something million dollars? Because it's in a limited budget, which we all exist in. And this is a conversation we haven't really had as a community yet, and we need to. Investing $100 million means doing a lot of amazing things that we haven't been able to do so far. For example, amazing weekend service on our transit routes, increasing both the number of frequent lines and also maintaining a lot of services that are hourly in some low density parts of the county, right? So it's just an open question that I think is worth thinking about, because money is money and it can go towards making transit free or giving more transit. And I'm not saying there's one or the other, it's just an interesting conversation.
Yeah, I would just quickly echo you on that, as I think, the allure of free transit is slightly less if the service isn't fast, frequent, and reliable. And so, yeah, how are agencies thinking about getting the service right first before we talk about the free transit aspect?
Yeah, maybe one more question, Maria, on streets, and then
one more question. Yep, and it's really asking, what are we doing to sort of make like residential streets feel more like public spaces, especially as we've seen that a lot of people just don't have access to to places to walk and to just enjoy some types of like recreational activities. So Jana, it would be great to sort of get your insights on what very like localized efforts can be done.
Yeah, I mean, very localized efforts, like I had mentioned in the presentation, there are a couple of examples of residents just shutting down their own streets. So that is really interesting. But then also, yeah, I think it's not necessarily shutting down residential streets, but I think in a lot of places we can think about potentially either shared streets or local only traffic. And so these applications, will be relevant after COVID-19, but local only traffic is an effort to decrease the volume of potential cut-through traffic on residential streets, as well as, just traffic speeds in general from so many cars driving on those streets. So if that's not something that we've really considered in Miami-Dade, and we think that there might be places that it could work even after COVID-19, I think it's a really interesting strategy, because it's not so harsh as to, completely shut down the street. You're not really altering traffic patterns super significantly. You're just kind of limiting who can cut through. And then also shared streets, this is also another kind of flexible use of streets. It's not really used so much on residential streets, but kind of the Woonerf idea, which I know that we are obviously seeing in development in Wynwood, thinking about other downtown streets that we could potentially do that on. I know that's a big goal of Avenue 3. So yeah, anything that's kind of popping up because of COVID that people are seeing value in, particularly in this crisis, I really would love, if our elected officials and transportation staff and stuff could pay attention to see how there could be applications for after this period.
Yeah, and Dana shared the spreadsheet that StreetPlans had been putting together with a lot of these ideas, and really with examples of what other places are doing, for streets. And that's it. That's all the time that we have for questions.
So we're going to wrap up. Stick around for the last 5 minutes, because this is actually the part that what's next. So if you stayed for all of this, you probably want to know what's going to happen with all this stuff. So stick around. I'm going to tell you a bit about what Transit Alliance is doing and how you can get involved. So like I said at the top, we have a coronavirus and mobility campaign. There's a few things we're advocating for. One, accessible testing for all. Make widespread testing accessible without a vehicle. As this crisis sort of evolves, we all know, if you're keeping track of the news, extensive widespread testing is going to be the way that we can get as close to something resembling normal as soon as possible. And giving access for people without a vehicle to get tested is going to be increasingly important. The second thing that we're advocating for is to keep Miami moving safely. So you heard me say it before, communicate changes with 48 hours notice instead of overnight, because we're going to have to continuously adapt to what's going on with our system. Prioritize the safety of operators and riders. TransitCenter is actually spearheading a letter to the coronavirus task force to advocate for adequate PPE for transit agencies across the country, which we have signed on to. Maintain frequent service on high demand routes, because we have a lot of essential workers who are still riding transit, and we need to make sure that they have adequate space to social distance and then they can still get to work. Deploy bike and scooter sharing for essential workers. This is something a lot of cities have been doing with great success. And just think about a second for a nurse who has to get to all these medical campuses that are just a little too far from the metro rail stations. Talk about bad planning. And really filling in that gap for them after a 12-hour shift. Things like that is where mobility can really play a role in this. We're also advocating for us to adapt and recover, so to repurpose streets as shared spaces. If you haven't checked it out, and Maria, maybe you can put it in the chat before we leave, that article that Linda wrote in the Miami Herald is amazing, will give you a lot of great context on what's going on. Build bicycling infrastructure before traffic returns. This is exactly the sort of time for all of our transportation planners to stop complaining about all the traffic and building all the bike lanes impacting traffic, because there's no traffic and it'll take a long time to come back. So, ta-da! Lastly, we touched on this already, implement the bus network redesign before restoring service. And if you want to learn more about it, stay in touch with us because we'll have a webinar just about that. So I want to know what you think. I want to know between these priorities, what do you think is the most important one? So I'm going to launch another poll. Let me know what you think. You can select multiple. You can select accessible testing for all, keep Miami moving safely, adapt and recover. Do you think all of them are important? Do you think some of them are not so important? Do you think there's something else? So maybe if you selected I'm a mystery in the first poll, you select something else, but you please tell us what that something else is, because it's part of the reason of this conversation is that we find out exactly what those other things are that you feel like we should be advocating for. So please put it in the chat box. We're going to give a few more seconds of voting. So if you haven't voted yet, get your votes in. All right. Most of you feel like, I'm going to share the results. Most of you feel like the adaptation and the recovery is the most important thing to advocate right now. Sort of in hand with accessible testing for all, keep Miami moving safely, a strong third, and there's a something else, which I'll look at the chat box later and we'll see what that is. So to wrap up, you can check out the campaign at translines.miami/coronavirus. You can join our advocacy, send us an email, help@translines.miami. We love hearing from all you people. Emails go to me, to Marcia, to Maria, to Derek. We love hearing from you. Send us an email, text, Twitter message, it doesn't matter. Please always get in touch with us. Before we wrap up, I really want to thank Dana and Ashley for joining us. It's wonderful to have you both here. And if you want to support Translines, we're a nonprofit organization, become a patron, $2 a month. That's it, helps keep our work going. All the things that you voted for and expressed that you care about, it really helps that you support your local nonprofit. So $2 a month, translines.miami/join, become a patron. You get all sorts of cool swag. You get early heads up on some of our campaigns and what we start to do. But also, we just all build a little community together. We're in Miami. We believe that this is the way that Miami should move forward. And $2 a month can really help us do that. So thanks so much for joining. I know that we can't do like a correct collective hurrah because webinars won't let me unmute everyone, but it would be wonderful that if you found this valuable in any way, just type it in the chat box, say hi, bye, thanks, good to see you. We would just love to, any feedback that you have in terms of, you can even be anonymous if you want. This was helpful, this was not helpful. Maria, Dana, Ashley, some last words before we end?
I mean, just thanks for having us. I love being involved in these conversations, and I love seeing so much interest from a variety of people in Miami. So yeah, this was awesome. Thank you for facilitating and having us.
Yeah, also just want to say thank you. This was great to be a part of. And I think, it's a time when a lot of us need to be, advocates across the country really need to be working together to develop